Good afternoon, everybody, and welcome. This is Stephanie Hall, and I am with the ESRD NCC National Coordinating Center. Thank you for joining us today for the NCC Professional COVID-19 Educational Webinar event. As you know, these events are being held in partnership with the Centers for Medicare and Medicaid Services. The series of events feature guest speakers from around the country sharing how they or their organizations they are with are coping with COVID-19. Before we get started, I wanted to let you know that this call is being recorded and will be posted to the NCC COVID webpage within about 3 business days. Our event is providing one CEU. To obtain your CEU, please stay connected to your computer after the event has closed. A screen will pop up, and we ask that you please complete the evaluation. After completing the evaluation, you will be taken to the NCC Learning Management Center where you'll be able to get your CEU. So let's talk a little bit about our call today. We have our guest speaker, Dr. Daniel Sukar. He is a Director of Behavioral Health at Rogosin Institute. The topic today, he's going to be talking about COVID-19 burnout and compassion fatigue in the dialysis center. Everybody is muted upon entry into this event, but we do want to hear from you. So if you have questions for the presenter, please send them through the chat. And at the end of the presentation, we will get through as many of the questions as we can and as time allows. So what's this call about? We talked a little bit. We hear from different stakeholders and peers in the community who are adapting to COVID-19. We have these calls twice a month. They're on various different topics related to COVID. Many of them share examples and provide some real-world strategies for facilities to use. So let me go ahead and introduce our speaker in a little more. As I mentioned, it was Dr. Sukar. He's currently the Director of Behavioral Health at Rogosin Institute, a kidney treatment and research institute in New York City. His research and clinical focus has been on the psychosocial issues relevant to patients with end-stage renal disease. He has done novel work developing and testing treatments for depression, insomnia, pain, adherence, and anxiety for people with renal failure. He lectures frequently on psychosocial issues for patients with chronic kidney disease and has written extensively in the scientific literature, with his work cited over 3,500 times. He is also the lead editor of the recent volume, Psychosocial Issues in Chronic Kidney Disease. So Dr. Sukar, I'm going to go ahead and pass you the ball so that you can move your slides. Okay. See.
Thank you very much for the kind introduction and for the invitation to speak today. Nice to meet everyone, a nice large crowd on the webinar today. If at any point you have any questions for me or comments, I will do my best to kind of keep my eye on the chat while I'm speaking, although it is sometimes hard for me to walk and chew gum at the same time. So, bear with me as best as I can. So today the topic is COVID-19 burnout and compassion fatigue in the dialysis center. And I have no financial disclosures. And the learning objectives for today, the first one is to describe the unique confluence of events and stressors associated with COVID-19 that are risk factors for staff stress. Second is to understand the similarities and differences between burnout and compassion fatigue, which are words that are often used interchangeably, but we'll kind of drill down a little bit in how people are using them a bit more specifically. And then third, to provide a framework for the development of psychological resilience. So, many of us are all zoomed out, COVIDed out. And so I was trying to think of ways to kind of present some of the things that I'd like to talk about today in perhaps a bit of a different way than you might have seen beforehand. So, we've all gone through profound changes to life's domains. And, one of the ways of thinking about them is this construct called intersectionality. And I'll come back to that in a moment. But as individuals, we've all been affected by COVID-19 based upon our individual risk profile, our age, our health status, our personality. Some of us tend towards anxiety. Some of us might be a little bit more laissez-faire about the circumstances. So depending on who we are, we being the broad public, we've all been impacted in different ways by the actual threat and risk of the virus. There's been professional challenges, and now here the we is, those of us working in the dialysis center, and I'll kind of come back to that a bit later specifically, but in healthcare in general, there's been both increased risk to the people that have been working in healthcare and increased demand. People taking more shifts, people doing more activities that are perhaps a bit beyond what they usually were asked to do. And it has been a challenge, certainly professionally for people, in addition to the individual challenge that they were going through. And then on top of that, there is domestic responsibilities. Some of us might have childcare responsibilities, older relatives, significant others. So who we are in relation to the other people, the important people in our lives, has really been impacted by COVID-19, whether people are in school, people are working from home, people are laid off. All of those things impact us as individuals. And then as community members as well, 2020 isn't only about COVID, it's really about, pandemic living and social justice issues, the fears of violence, politics, everything is kind of combines together. And that's where I'd like to introduce this idea of intersectionality, which is not novel, but sort of new to me. And it's a way to think about how different concepts all affect a person at the same time. So we might be members, we're a particular gender, we're a particular ethnic group, we are an educational class, we are a group of people that work in a particular environment. And each of those groups might have different challenges going on as a result of the pandemic or as a result of life in general. And for us, how do all of those different circles intersect one another? That's really a way to understand how us as individuals will have been impacted by the pandemic itself. So the point that I'm trying to make here is that as individuals, as professionals, as members of family, and as community members, we've all been impacted, I would say, profoundly by the COVID-19 pandemic. And for each of us, those circles might be a little bit different, and how they all intersect really will predict how some people have responded and some people have, why they've responded one way and why other people have responded a different way. And all of these challenges have all happened with the withdrawal of our usual means of support. So whatever we would normally do to help ourselves feel better during challenging circumstances, pretty much no matter what we did as our usual coping strategy, COVID-19 really impacted our ability to do that. So for those of us that are in, I guess it's all of us that are working at the dialysis center, so our patients are more in need than ever. They've lost much of their connection to their social network. So for people that are working at in-center facilities, certainly that might have been the only social connection that our patients had during those really difficult months. So while everyone else was higher need and more demand, that left us, I think, a bit more extended even than we would have been, despite all of the other difficult challenges that were going on. So I had the opportunity over I guess it was really last summer, to run groups for staff and patients, dialysis patients at the Rogerson Institute, and to help people cope and really just to kind of listen to hear what their challenges and what they were going through, what it was about. And, it's very dynamic, I would say very individual and very dynamic, changes all the time. And I put together some of the things that I highlighted, and I'll even update it kind of as I go through the list, because even between the time of kind of preparing the slide and in this moment, I think things have changed somewhat. So certainly from last summer, for the past year, people were very concerned about their own health. They were concerned about, their family members' health. How could they protect their family? Concerned about their patients, concerned about their job responsibilities. And now I think where things have kind of moved to will things ever go back to normal? How is outpatient practice going to change? When can I safely resume my duties? the questions around the vaccine, I think have evolved from when will the vaccine be available to my patients and to us to, what's going to be the level of acceptance of the vaccine amongst patients and staff members. And then, ultimately, what's the efficacy of this vaccine going to be? There's some data coming out which is a little concerning about transplant patients. What is it going to look like when we have a fuller picture of actual levels of immunity for our patients with compromised immune systems? Similarly, there's social distancing concerns. When will my kids be able to go back to school? For how long? When will I be able to see friends and family again? Will that be safe? CDC guidance last week, the change is really kind of dramatic, and many people are still kind of wrestling with, is that a good idea, a bad idea for me? Is that safe? Am I ready for this? How will I cope with loneliness? Will life ever get back to normal? I've said over the pandemic that, there are many people were dealing with isolation issues. They were feeling really detached from other people, but there were also, a large group of people that were dealing with what I would call togetherness issues, being forced to be together, perhaps, used to some of their own time, used to more distance from one another. And after a year plus, that can really have an impact on the quality of those relationships. And then, the emotional concerns, which I think is really where we're just starting to get to. How is this experience that we've gone through, how is this going to impact me? How am I going to grieve the loss of life? How am I going to cope both in the short term and in the long term? Can I handle this again for months to come? I think that, that hopefully that is behind us and we're not going to have further waves of COVID. But am I nearing my breaking point? How much of this can I handle for how long? And then what happens at the end of this? Do we just flip a switch and go back to the way that we were? Or is there some new normal that we reach? I think that's the types of questions that people are going through at the moment. So I'll include some data. This is a survey that was done in the United States, not a very scientific survey, but still kind of interesting. It was 226 nurse leaders, and they asked a variety of questions. But to me, the point of this is just kind of striking how high these rates are. So 61% of nurses reported having emotional and physical fatigue. That's a really high number. 53% of people cited challenges with inadequate staffing. 35% said it was difficult to meet work and family demands. 28% wished for more adequate support programs for emotional needs and well-being, and about a quarter of the people say that they have suffered compassion fatigue in dealing with the traumatic events of the past year. So those are really, really high numbers. What I'd like to do is talk a little bit about this from a scientific perspective. And this is based on the work of Bruce McEwen from about 20 years ago or so. And he outlined this process called an allostatic response or an allostatic load, which is really how our body responds to stress. And it's the kind of the total combination of both the physical and emotional, rallying that we do in response to a stressful occurrence. So you can see here, I hope you can see my arrow, but the stressful event happens, we begin to kind of manage it, and then slowly our body responds and we go down the slope and we have a full recovery. So we go back to the point of where we were beforehand. So as an example of this, I don't know, we get an annoying notice that I'll use an example from my life, an annoying notice that your Wi-Fi bill wasn't paid, even though you paid it, and they're going to shut off your Wi-Fi, which is your key to doing your work remotely. And then it's annoying, you deal with it, and then you kind of, after it's dealt with, you move past it, and it's no longer something that you carry with you forward. It's just an event that has fully resolved. Dr. McEwen also had a different model, which is what he called consecutive stressors, which is when, one stress would happen, we would respond, we would fully recover, and then another stress would happen, and then we would fully recover. And I guess, for some people, if you took a more macro view of life, this is probably kind of what it looks like. Something happens, we respond. Hopefully there's some more break in between the stressful events than I've shown here. But essentially, an event happens, it it concludes, and then a different stressor happens, we resolve it, it concludes, and then we move on. But then there is a third kind, which is what he has termed compounded stress. And that is when, maybe a model of waves hitting the ocean. So we see that, an event happens, there's a stressor, and as we're beginning to respond and cope with it, another wave of that stress happens, another challenge occurs. So we haven't really gotten fully all the way back down to baseline, but yet something else has happened. And then as soon as we're working on that, another thing happens, and then another thing happens. And what we see is that the peaks keep on getting higher and higher, and the troughs, the bottom here, keep on getting also higher and higher. We don't recover as well. They get shorter, and these spikes go higher and higher, almost into uncharted territories. We are going into places that we are not really that comfortable or familiar with. We don't know what happens. How much stress can I take is the question that begins to come in people's mind as we get to, this portion of the stress curve. So I think one way of thinking about that is, or describing that experience, is something that we call burnout. And burnout is not in the DSM-5. It's not a psychological or official psychiatric diagnosis. It is acknowledged by the World Health Organization. But I think it's something which is up and coming. We're going to see a lot more research about this, in particular, I think because of COVID and the pandemic. But burnout is described, one quick way of kind of remembering it is kind of work-related depression. It's, feelings of being overwhelmed or worried, predominantly about, kind of whatever repetitive tasks we're being asked to do, typically around work-related activities. People find that they become easily irritated, that they feel tired. There's changes in their sleep patterns. They can have somatic complaints such as headaches or a stomach upset, things like that. And then there also tends to be a higher rate of alcohol and substance use. And what we see is that, as the challenges of the pandemic have gone on, rates of burnout have been reported to be very high. And the way that I think about it is, burnout is something that can apply to anybody in any different profession that they might have. So, the accountant who is just kind of sick of doing all of their work through Zoom and all of the challenges that have happened in their lives due to COVID, they can experience burnout. So here's some recent burnout data. This is from the Washington Post. They did a survey of U.S. healthcare workers. And one of the questions they asked was, would you say that you feel burned out about going to work these days or not? And now amongst healthcare workers, 55% of people said they feel burnt out. I mean, that's a really sky-high statistic, right? More than half the people feel like they're burnt out. And what was interesting is that there seems to be this trend in a variety of the different studies that we look at, where people who are newer to healthcare, that are younger, have higher rates of burnout than people who have been around for a bit longer in the healthcare field. So in this particular study, 18 to 29-year-olds reported nearly 70% of a rate of burnout, but people 50 to 64 were 43%. It's unclear whether that is going, what the impact of this level of burnout is going to be, and whether there's going to be a differential effect for folks that are at the earlier parts of their career versus the later part of their career. Perhaps we will see some more turnover, and I'll show you a statistic in a moment. So burnout, as I've described, is kind of analogous to workplace depression. And this other concept is called compassion fatigue, and I think of it as being more analogous to workplace post-traumatic stress disorder. And it is really unique to professions that have gone through traumatic difficulty over the past, through their professional work. So it's not only healthcare providers, but it certainly could be, healthcare providers. And some of the signs of compassion fatigue, just like post-traumatic stress disorder, are the reoccurrence of nightmares and flashbacks to the traumatic event, or a vicarious event. And a vicarious event means it's not only So let's say, a nightmare or a flashback to the loss of a patient would be, the first one. But a vicarious event would be as the patients describe to you the traumas that they're going through, or the challenges that they have at home, or their difficulties, kind of absorbing their stress and absorbing their angst is what we call a vicarious event. So it could be that you've experienced it directly, or it could be that you have just been kind of privy to it through your professional role. And what people report feeling is apathy, detachment, and they no longer find activities pleasurable. So it's a little bit different than just feeling depressed, but rather is kind of like a numbness to the predicament that that this patient might be, expressing to you. And for most of us, that's pretty out of character. We've chosen healthcare to help, and we feel empathically connected to the people that we're working with. And, it can be quite a dramatic and traumatic change for us to kind of look at ourselves and say, I just don't feel as, connected or caring about the people that I'm working with as I have had before. And that is one of the kind of telltale signs of compassion fatigue. Similarly, there's difficulty in concentrating, feeling mentally and physically tired, physical ailments like GI upset, recurrent colds, kind of just general lower level immune function. And then, one of the features that has been suggested is that it's often not identified as a problem. It's insidious, so it happens often slowly, and people don't just say, yesterday I was feeling great and normal, and today I'm feeling terrible, but rather it's over a long process. Kind of day by day, we've been worn down by all of the different events that we've seen, all of the different things that we've been asked to do. It just takes its emotional toll over time. So healthcare workers are particularly vulnerable. And I have two quotes here from some of the kind of pioneer researchers in compassion fatigue. All of us who attempt to heal the wounds of others will ourselves be wounded. It is, after all, inherent in the relationship. The expectation that we can be immersed in suffering and loss daily and not be touched by it is as unrealistic as expecting to be able to walk through water without getting wet. So, they have these quotes, which I think are very, meaningful and really highlight the point that we should really be prepared as an industry, as a workforce, for the emotional toll that this kind of work will take on people, especially when they're going through such challenging times, and it's so widespread amongst all of our patients. Actually, earlier today, I was running a support group for caregivers of patients who receive their dialysis at home, and just kind of hearing about their trauma and their stress, it was reminding me of all of the things that the healthcare workers are going through, except the healthcare workers are expected to just be professional and kind of move through and, and deal with all of these additional challenges when, it is really a high ask of people to kind of go through this emotional connection with people and then just be able to compartmentalize it and move forward. In particular, I mean, it might be challenging at all times, but in particular, when all of our patients are going through it simultaneously, plus, like I started off with at the beginning, we ourselves are going through our own challenges of the pandemic. So another question from the Washington Post survey: as a result of the COVID-19 pandemic, have you considered no longer working in healthcare or not? And the answer was yes, 29%. And again, I don't have the numbers here, but it was stronger amongst those who were younger than those who were older. I guess pragmatically, maybe it's a little more difficult to change careers as we get a bit older. But I think people who are new to the field are saying, this is not really what I signed up for. This is hard. And I think we're going to see over the next months and years, a really profound shift in the types of work that people are interested in doing. There might be more people that are drawn to healthcare. There might be people that decide that this is not really for them. This is not what they signed up for. So I think dialysis staff are particularly vulnerable, and I have some reasons here. And if you have other reasons why you think that might be true, you can feel free to either chat them or send them to me. But um, there's really close ties between staff and patients. The care can last for years. Often the staff is assigned to the same patients, and not only is it that it lasts for years, but there's really this very high frequency of treatment. Um, so just from the kind of exposure itself, there's a really strong degree of connection between the staff and the patients, and that lends itself to development of an emotional connection, which is often deeper than what is typically experienced in healthcare settings. And I think there's another element to it as well, which is that there's a high potential for complex relationships with patients. And by that, I mean, so the patient has to come regardless of whether they're really in the mood to come or whether they really want to see you that day. And, that leads to, sometimes people show up and they're not at their best. They're not at their emotional best. They're not at their kind of best in any way. And despite that, it's our responsibility to deal with them and to provide, the highest quality care that we can. In general, I think, challenging patients are difficult to manage within the dialysis system because of the life-saving nature of dialysis. So we really have to be very, responsive to patients' medical needs, appropriately so, but that does make it difficult to deal with people who are not following the rules or who are difficult. And as a result, we can't discharge patients easily from care. So that does lead to some complicated relationships with particular patients. And that, falls upon the staff to essentially just kind of find a way to deal with it. One example or analogy that I often use is that in most areas of healthcare, it is like inviting somebody over for formal tea. You get to meet them occasionally. They're on their best behavior. People might even dress up for it. Everyone, does their best to kind of maintain this illusion of propriety. And dialysis care is more like the house guest that has perhaps stayed past their welcome, right? So you walk in or they walk in, it's you again. They've already had this conversation with you maybe 3 times this week. They're kind of over it. They don't want to hear what you have to say anymore. You don't want to hear their objections to it anymore. Like some of the formality and the effort that people put in is stripped away because of the frequency of care and the duration of care. So that can really lend itself to be a pretty complicated circumstance at times. So this is a British survey of kidney care providers, and they sent an email out to all of their professional networks of physicians, trainees, nurses, and other dialysis professionals. And it's a biased sample, but it's just still interesting. So they sent it out to thousands. Only close to 200 responded. But of those that responded, 54% reported burnout, which is actually pretty similar to the rates that we saw from the Washington Post survey. Similarly, again, higher rates for younger workers and equal rates for both men and women, and not statistically significantly different, but again, this is just a kind of sampling of people, but we saw that physicians had a lower rate of burnout or reported a lower rate of burnout than trainees or nurses, and other professionals involved in dialysis care reported higher rates of burnout. Whether that is generalizable or largely true, I think is unknown until we can see some larger data sets that report the same thing. But it is kind of generally in line with the types of information that is coming out, which is that the rates of burnout are really, really high. And I think that people that have opportunity to do other types of work are going to really be questioning whether they want to do this particular kind of work for longer. And the more mobile your degree or your work is, the more likely it might be that you're considering changing professions. So up until now, I've kind of described all of the challenges of the pandemic, and I would like to kind of shift focus a little bit and talk about as I've said here, from challenge, opportunity. And I start off here with a quote from Henry David Thoreau: "Not until we are completely lost or turned around do we begin to find ourselves." So to me, in this context, the quote means, we're really asked to question our value system. Why did we choose the careers that we are in? Are we happy with doing the work that we're doing? Is it meaningful to us in the way that we had hoped it was going to be, or perhaps in the way that it once was? And if we can get affirmative answers to those questions, then we can, reapproach our work with renewed vigor. There's opportunity here for gaining some perspective about the meaningfulness of the work that we do, and then taking that perspective back into the work. So to go back to Bruce McEwen's work, so not all models look at compounded stress. There's another model, which is adaptation to stress, which in this model, even though you're getting hit wave after wave of stress, what begins to happen is that the height of the stress, though our response to it, it gets lower and lower. We learn something that the second time we go through it, it's not quite as novel, not quite as challenging, not quite as difficult as it was the first time through. So we have begun to, respond in a different way. Perhaps a less dramatic response is required because we're not perceiving the stress as being quite as difficult as it was. And the longer it persists, or the more waves there are, another way of looking at it is that there's more opportunity for learning. We are, not caught off guard anymore. We understand both on a, let's say, professional infection control level and on a personal level what we need to be doing to cope well with the challenges that are being presented. It doesn't feel like it did, I don't think, the same way it felt last March. We've learned a lot. Things are kind of different. There's more structure. There's more things in place that allow us to respond to these new waves of stressors in different ways. So that's a bit of a scientific perspective. And I came across this and I just thought it really kind of highlighted the point. This is a Japanese pottery technique called Kinsugi. I do not speak Japanese. I'm sure I butchered that, which I understand means to repair with gold. And it's the art of repairing pottery with gold lacquer and understanding that the piece is more beautiful for having been broken. So what they do is, instead of just trying to glue it back together, they find a way to highlight, the breaks. And it's become an analogy or a symbol of the growth that can happen as a result of adversity. And the psychological way of expressing that is either called resilience, or more specifically, what we call post-traumatic growth. And what that refers to is a positive psychological change experienced as a result of adversity and other challenges in order to rise to a higher level of functioning. So I started off by asking, are we going to return back to the level of normal that we were beforehand? Is there just going to be a switch and we're going to start, behaving the way that we were behaving in, early 2019? And to me, the answer is, I don't think so. I don't know if that's ever going to be possible for anybody, but I hope that we've all gone through this experience and we have taken lessons about who we are and what's of value to us. And we're going to take those lessons and be able to move forward with them into whatever our new normal looks like. It really shouldn't look like the old normal, and that's not necessarily something that we should be aspiring to. So I have, outlined here some skills that I think are necessary for what I've called thriving and surviving. And excuse me. So the data has shown that the most important thing that you need to do if you're experiencing burnout or beginning to feel that you might have compassion fatigue, there aren't really clinical trials that have been, designed yet, so there isn't really like an empirical evidence base. But what the articles all seem to suggest is something called respite. Is essentially taking a break from what you're doing and allowing yourself to recharge. And I think that's kind of intuitive. People know that when you're feeling worn out, you just need a break, go on vacation, do something which is different, clear your mind. But obviously, COVID-19 has been a very challenging time to do any of those things. It's hard to take a vacation. It's hard to get the time off. It's hard to do, and even if you can do all those things, there's really nowhere to go and nothing to do. So it becomes very hard to really take that respite in a kind of physical and concrete way. So despite that, though, we need to find ways to be able to give ourselves a break from the strain of the work that we're doing. And what I've outlined, and I'll talk about for the next few minutes, are some skills that I think are helpful not only in responding to the negative effects of burnout or compassion fatigue, but are really the necessary building blocks for developing post-traumatic resilience or growth, so that we can learn how to take advantage of the challenge that we're going through and come out a little bit stronger on the other side. And I think, and this is just my own thought, the three main skills that really we need to maintain through the challenging period and then to grow on the other side are skills for managing uncertainty, skills for remaining socially connected to people, and skills for developing healthy life rhythms. And I'll spend a moment talking about each of these individually. So the first one is, managing anxiety. How do we go about managing, all the strain that we experience? And, that I think anxiety is really the theme of the year, unfortunately. There are so many things that are still unclear medically. There are questions that just don't have reliable answers yet at this point. So how do we go about living in a world where the answers are not there, but, and they're very, very important for us to know? So the first suggestion I have is to evaluate the productivity of your worry. Is it meaningful, what you're worried about? So to decide for yourself, is it a productive or unproductive worry? To evaluate the usefulness of your concern. And if you can't change it, there's no value in worrying about it. So a lot of times, there's other challenges. People will say that, oh, I can't stop worrying about things. But I think the first step in this process is acknowledging what is really worth thinking about and what is not worth thinking about at this particular moment. If there's no decision facing us, what is the value of the rumination, of it kind of churning around again and again in our mind? A little quote here is, worry won't stop the bad stuff from happening. It just stops you from enjoying the good. So this is certainly true. I think we've all experienced this in terms of watching the news. We can get tuned into a 24-hour news cycle where we're just constantly being bombarded with all of the challenges that the world is experiencing. And that is overwhelming to anyone. So, limiting the amount of exposure we have to the news is one example of thinking about whether this is productive or unproductive. We certainly want to know what's happening in the world, but do we need to be kept up to the minute about, kind of conjecture of all the things that might be going on? Probably not. And then I think once we've decided that, some things are unproductive, we try to dismiss them as best we can. And then the things that are productive, we go ahead and make a decision about. And then another technique, which I think is extremely powerful, is the power of acceptance. And here's a little example I have of the difference between acceptance and non-acceptance. So it's a rainy day. Person's thinking to themselves, I don't like the rain. I wish it wasn't raining. My day would be better if it wasn't raining. My day is ruined. Every day is like this. Why does the rain always happen when I want it to be sunny? It's never going to stop. All this negative thinking about the rain. And somebody who has acceptance says, it's raining. Yep, it is raining. So I think that's, unfortunately, a tool that we've been asked to develop this past year. It's been raining a lot. There's a lot of things that were happening that we didn't want them to happen that way. But yet we have to find a way to be able to accept that this is a difficult time at the moment. It is raining, but inherent in that, it's not going to rain forever. We just have to make it through this time. And if we have the psychological resilience to just say, I can weather this storm, then we come out a lot stronger on the other side. The second key skill that I think about is social connection. And this is something which, we are really hardwired to have in our lives. And different people have different needs for the amount of social connection that they have, and that is certainly true and should be honored. But at a basic level, as part of, the animal system, we crave connection with other people, others who are similar to us. So on a personal level, it's been really hard, but we need to make an effort to remain connected to our social networks. As humans, we need to connect and be connected. And I think at this point, maybe everybody in the world is kind of sick of doing things through Zoom. But if that's all that we have available to us, it's better to connect with other people through some, less desirable method than it is to just remain unconnected. And if we keep on telling ourselves that, perhaps we'll get up enough energy to actually muster, attendance at some of these activities. But it is really important for us to not just withdraw, because that withdrawal sets the stage for, isolation and depression. And then professionally, our staff requires the opportunity to be connected and appreciated. And whether you're an administrator or social worker or dietitian, any role that, a technician, whatever role you might have, it is vital that we kind of have the camaraderie of our colleagues. And, when you ask people what's the best part of the job, most people will often say something along the social network. It's the ability to help people. It's being connected to my patients. It's the people that I work with. So we really need to be respectful of how important that is in a work environment, and how, COVID has made it really difficult. And, some places are beginning to lighten up some of the restrictions, but, not being able to communicate without a mask on, not being able to eat lunch together, not being able to kind of socialize, or the social components of the job, that all takes its toll. And, we get kind of left with the job part of the job, but without the, some of the enjoyable parts of the job, the human connection parts of the job. And that can be really hard. So I think there need to be systems for open and clear communication between staff members and leadership, but also just amongst the staff. How are we supposed to communicate with one another? How are we supposed to kind of get these needs met in some way? I have an example here of something that happened here at the Rogerson Institute. So we want, it is challenging. People no longer eat together, like I said, and people were feeling very left out. And one of the facility administrators, had these made that you're a lifesaver, and kind of had this lifesaver cake, and gave everybody an opportunity to eat the cake. And then also, these lifesaver cupcakes. And I think it's just a demonstration for people that, there are folks that still care about you, and that even though you can't just kind of pop into their office and have a chat, perhaps in the same way that you might have beforehand, that there are people that are out there that are still thinking about you and want to connect with you in different ways, and thinking about other ways of connecting. I know there was one group in, I believe it was in Chicago, that they kind of organized their break time so that 2 or 3 people could get off at the same time, and they would walk to a local park, which was just a few blocks away from the dialysis center, and they would be able to kind of sit there with their masks off, it's socially distant, and be able to talk with one another kind of eye to eye, mouth to mouth, and just, in a relaxed environment, even if it was just for a few minutes. And I think things like that are really very, very powerful for people to just feel, connected and valued in the roles that they have. And the third skill that I wanted to talk about was, healthy living, or being in rhythm. And, I think that this is where COVID perhaps has hit the hardest, is that, all the routines that we build our lives around were really disrupted. And to feel our best, this is true for our patients, this is true for the physicians, for everybody involved in all humans. To feel our best, we need to be eating on a regular schedule. We need to be sleeping on a regular schedule, and we need to have physical activity on a regular schedule. And I think all of those things were particularly challenged by COVID-19. And as we're beginning to get back into our new lives and we're looking for opportunity for growth, we can really like own the important role that all of these things took in our lives. And perhaps we were, myself certainly included, somewhat neglectful of, the kind of primacy that these routines need to take in our life. But now, having seen the ill effects of ignoring it or not being able to have them, to really think about them in a much more serious way and to prioritize them amongst our goals so that we can move out of this experience, feeling healthier, stronger, and more well rested. So just my final slide here, trying to bring everything together. How do we build resilience? So the first step, I think, is to start with an honest assessment of what's going well and what's not going well. And this might be the hardest step, is to really acknowledge that there are things that are not going well. I'm struggling here in this area, or I'm doing okay in this area. I don't need help. And as part of that effort, you want to identify your strengths and areas where you can improve. This is something that I'm doing very well. This is something that I'm not doing very well. So, we've gotten, our eating under control. It's not takeout every night anymore, but I have not, exercised in quite some time. So let me really start thinking about how I could prioritize that. And then develop an asset map, which I think is, borrowed from other literature, but, who and what resources can you draw upon? We've been kind of forced into isolation over this past year, but now as we're beginning to come out and it's beginning to be safer, what are the community resources that are available to us? They might be kind of, let's say, our traditional network resources, people and things that we relied upon pre-pandemic, or maybe they're new ones. There's new activities that have been created in response to COVID-19. Are any of those resources available or meaningful to the areas that we could use some improvement in? The fourth is to acknowledge your emotions. And, this is something that I found that, particularly amongst the nurses, they will say things like, when it's a difficult time, you just kind of put your nose down, do your work, and get through what you need to get through. And I appreciate that. That is, obviously a fantastic mentality to get through difficult times. But I don't think that that mentality works when the difficult times is now, going on 14, 15 months. It's just too long to say, I'm going to deal with this later. I think, to move through this successfully, we need to have a awareness and our acknowledgement of what our emotional state is. Is this hitting me particularly hard? Are there things that I need to talk about with other people? Are there experiences that I need to process on my own? Are there particular patient stories or particular things that I've done over the past year that I really need to spend a moment and pause and focus on and understand them a bit better? So once we kind of do all that, we want to develop a plan for moving forward. And as they say, hope for the best and prepare for the worst. So have maybe different levels of contingency in the plan. What happens if X, Y, or Z happens the way that I want it to? And what happens if it doesn't happen the way that I want it to? How will I handle that? Are there any things that I need to do now to put into action or in preparation for, these scenarios that might happen that will be difficult to handle if I'm not prepared? And very importantly, we need to have a plan for self-care. And like I think I've been saying, we need to concentrate on both our physical and our mental health. Physical health, it's about eating right, exercising right, and sleeping right, prioritizing those goals within our lives, and really putting effort into making sure that we are getting what we need, putting what we need into our body and getting what we need out of it. Because if we're not feeling physically well, there's no way that we're going to feel mentally well. And then for your mental health, be honest about your needs. And something that I've been attempting and kind of working towards is practicing gratitude. There's so many things that were taken away from us this past year, but there were also a lot of things that we really got to explore perhaps on a deeper level. So, finding the ways to be grateful for the changes that have occurred or some of the novel experiences that we've had, can be very powerful. And like I said before, take physical and mental breaks. That really can't be overemphasized. We all need breaks from the routines that we are doing, especially if that routine is very demanding. Vacation is not a luxury; it's part of self-care. So just taking a break, whether it means going somewhere or not going somewhere, just getting a mental and physical break from the challenges that we're experiencing day to day, we will find that we are renewed when we come back, and we'll have more in the reservoir to be able to handle some of the challenges that we're being faced with. We also want to develop short-term attainable goals. We want to not only think about the long term, but let's think about the short term. What can we do now? What can we do in the next month that will really help us begin to feel like we're moving forward on some of these things that we've identified? We want to celebrate our own successes, even if they're minor. Sometimes there's just a limited amount of things that we can do with all of the limited resources that are available right now. But let's, whatever we are able to do, let's celebrate that and really feel good about the successes we have and not just dismiss them. And finally, accept that some things are just challenging for now. Maybe we're having thoughts about whether this is the right career for us. Maybe we're having thoughts about whether this is the type of work that I want to be doing. If now's not the moment to really, have those changes, so then just leave it be for a moment, and we'll come back and we'll reevaluate, when the moment is right in life. But giving yourself the permission to just not kind of constantly mull it over again and again might be very liberating. So that is the end of my prepared comments. I am very happy to have any reactions or questions or thoughts from the audience.
Well, great. Well, thank you, Dr. Sukor. I'm going to take the ball back real quick then. There is a couple questions that came in or comments, but before we get there, I just want to say, a couple of as I was listening to your presentation, you're right, this past year, last year, up until just maybe recently in the healthcare field, we've just been so saturated with COVID information and technical information, vaccines, infection control. And I see by the number of people who are attended this webinar today that they are very much interested in learning more about, or hearing about compassion fatigue, how we can take care of our mental health. We spent a lot of time talking about physical health over the last year, but I don't think we've touched enough on the mental aspect of it. So this was, a great presentation. And I know, as you're speaking, I'm like, and something you just said at the end about routine. I again, just on a little of a personal note, working at home since last year, I found myself just kind of, not having a routine and finding myself just making myself having to go back and set that alarm, get up and go to the gym, and get back into a routine, and what a difference that made right there. So really, you really hit a lot of those, again, I'm sure everybody could certainly agree and probably will hit home on many of those. So thank you for sharing all that. So
Sure.
let me, looks like they came in here to me. So let me, a couple of them, like I said, are comments, but let me go ahead. It says, one from Stephanie says, I feel like working in healthcare, we were at an advantage. Even working in stressful environments, at least we were able to see our coworkers and patients and not be isolated. So making something positive out of definitely last year.
Well, I've heard, there's challenges in all different fields. Certainly, if you know anyone who's in the music industry or in, entertainment, it's a field that has been hit so hard. Many people say they're just happy to have work. That is certainly, all true. One thing that I've heard also is that many people in healthcare, now that they're kind of beginning to re-socialize with their friends, they find that their COVID experience was really, really different than their non-healthcare friends. And that, when people are talking about the challenges of, I don't know, whatever, all the, let's say, regular challenges that people have had, they don't quite line up with some of the challenges that people who are in healthcare, that were at the front lines of healthcare, had to deal with. And it can be in some ways isolating as well, because you don't feel like your regular support community has gone through the same experience that you've gone through. So, I think that's, it really depends on how you take it. And, certainly we can be grateful for the camaraderie that we have. And I think that's, again, one of the things lessons that, people I'm hearing the people are taking is that, the value that they place on their fellow colleagues and their fellow coworkers as really being the highlight or the important part of the job for them.
Yeah, exactly. I just want to share a few, again, comments that came in for you specifically, Dr. Sukor. Very good presentation. Yes, thank you. Thank you so much for this vital presentation. You hit on all of the emotions that we are experiencing while working in dialysis. Will you be able to share the slides, especially the quotes? I think somebody else asked me about the slides. Let me just reiterate, these slides will be posted to the ESRD website, at esrdncc.org within about 3 days, 3 business days. When you go to the homepage, click on webinar events, and you'll be able to see those slides and the recording. Both will be posted. So yes. Thank you very much. There was a question, is overeating a symptom of burnout?
I don't think it's one that is a commonly identified symptom of burnout, but it is certainly a symptom of depression, which is, very analogous to burnout. I don't think we know enough about burnout to say yes or no, but certainly, as I was kind of emphasizing the entire time, developing healthy rhythms for, eating, sleeping, and exercise are really vital. And overeating is just, a pretty common coping, not healthy, but commonly used coping strategy for when we're feeling overwhelmed. So I don't know if it's a sign of burnout. It's certainly a sign of, let's say, emotional need in the broadest sense.
Right, exactly. Thank you. I think one last kind of comment that came in again. This was great to listen to. I know for me, going home and speaking with my spouse, it sometimes felt like we were on 2 separate pages since she works from home. So yeah, I agree. A lot of nice comments. I agree. A much needed webinar today. Dr. Sukor, again, thank you so much for presenting, and I hope everybody learn something about themselves, about how to maybe deal with some compassion fatigue, or if you recognize it within your peers at work, maybe what we can do to help them, definitely. So just in conclusion here, I just want to point out that the ESRD NCC has a COVID-19 vaccination toolkit. It just got posted probably about 10 days ago on our website. We really encourage you to go and visit, download it. Lots of resources on there, mostly for staff, but also for patients. There's videos, flyers, articles, all kinds of information. So please, we encourage you to take a look at that, share it amongst your facilities and with your healthcare team as soon as you can. It's got a lot of good information. Again, let me just remind everybody, this is we're offering 1 CEU for this event. So once we close the event, please stay connected to your computer and you'll be taken to an evaluation. We would like to hear your feedback. Once you complete the evaluation and submit that, you'll be taken to our Learning Management Center where you'll be able to get your CEU. So again, thank you everybody for being here. Great presentation. They're still coming in, Doctor, for you. Thank you. Thank you for the great presentation. So a lot of nice feedback. So thank you, everybody. Thanks for being here today. Please take care and have a good rest of your day. Bye-bye.